Okay, time now for a new segment of SMX Insider. It is our SMX medical update with Dr. Joe McGinley. Some of you fans have probably seen him on our broadcast at the races. But for those who haven't, just tell us your story here. Yes, you are a true MD. You went to college, you have all the degrees, but also raced some motocross yourself growing up.
Yeah, great. Great to be on the show. Wonderful to contribute and talk about riders' injuries and provide some information. You're absolutely right. I raced back in the day. I still get out there on the track. Obviously, nowhere near the level of JT or any of these other guys out there racing. I was a local B rider, but yeah, I did it for over 15 years. So I know with some of the injuries, I know what the riders are dealing with, and providing just background and information and perspective is what we're here to do. And it's great to contribute and work with your team and the fans.
So I think for a lot of people that, core fans of the sport, to hear that a doctor is specializing and really working with motocross specific injuries or just things that are going to help them perform to their best, I think that raises a lot of questions. So can you tell us a little bit about how different it is working on a motocross athlete and their specific injuries versus maybe like a stick and ball sport athlete?
Yeah, JT, that's a great question. We deal with athletes, pro athletes in all different sports, and you have to take that sport into consideration, what the goals of the athletes are and what the expectations are of that particular sport. And I'll give one example, and that's ACL injuries. And if you look at NFL, for example, pro football players, when they tear their ACL, it's highly uncommon for them to get back out on the field for at least 7 months, 8 months after that injury. Whereas with pro motocross, we're seeing racers getting back out there and competing like nothing happened 3 to 4 months out. And that's the nuance of the sport itself, the different stresses on the joint, the different stresses on those ligaments, and how they're training and recovering and getting back out there. So that's a significant difference, and that's related to the stresses of the sport in general.
So all I'm really hearing you say is that our motocross athletes are the toughest that you've seen, and we can heal faster and get back out there quicker. Is that what you're telling me? Because I would love to run with that narrative.
I'm not disagreeing with that. As a rider and a fan of the sport, I'm going to agree with you 100%, JT.